Welcome back to our channel, where your well-being is our top priority. Today, we're diving into a topic that's crucial for every senior's health: the warning signs of a stroke. But before we continue, don't forget to hit that subscribe button so you never miss out on our valuable content. Also, give this video a like if you find it helpful. Stroke occurs when the blood supply to part of the brain is interrupted or reduced, depriving brain cells of oxygen and nutrients. This can cause permanent damage in as little as 3 hours without treatment. Recognizing the early warning signs is vital. Knowing these signs could be the difference between a full recovery and living with long-term disabilities. Let's start with the most common type of stroke, an ischemic stroke. It happens when a blood clot blocks the flow of blood to the brain. Here are 5 key signs to watch out for. 1. Sudden numbness or weakness, especially on one side of the body. Have you ever experienced a sudden tingling sensation or weakness that comes unexpectedly? This could be a sign of an ischemic stroke. When a stroke occurs, it often affects one side of the body more than the other. So if you notice any unusual sensations on one particular side, it's essential to seek medical attention immediately. This applies to numbness in the face, arms, legs, or any other part of your body. Don't ignore these symptoms, even if they seem mild, or go away quickly. They might be a warning sign that something more serious is going on. No to confusion or trouble speaking. Did you know that communication abilities are closely tied to the functioning of specific areas in your brain? When those areas are affected by a stroke, it can lead to confusion or trouble speaking. Imagine trying to express yourself, but finding that the words just aren't coming out right, okay? Or perhaps you're feeling muddled and can't quite make sense of what's happening around you. These could be signs that you're experiencing a stroke. It's important to remember that this symptom isn't just about misspeaking. It also includes understanding others and reading. If you or someone you know is experiencing these difficulties, time is of the essence. Act fast and seek help. 3. Difficulty with coordination and balance. Do you often find yourself feeling off balance or losing your coordination? While this might be attributed to aging or other factors, it could also be a red flag indicating a stroke. Strokes can affect the areas of the brain responsible for coordinating movement and maintaining balance. If you suddenly stumble, feel dizzy, or lose your equilibrium, don't hesitate to call for medical assistance. Remember, these signs could mean that you need urgent help to prevent further complications from a stroke. For severe headache with no obvious cause. Have you ever experienced a headache that seems to come out of nowhere and feels more intense than usual? While headaches are common and often go away on their own, a severe headache that appears suddenly, especially in older adults, could be a warning sign of a stroke. This type of headache is often described as the worst headache of my life. If you experience this, it's crucial to seek medical attention right away. Even if the headache goes away, it's still important to get checked out, because it could have been a sign of a stroke that didn't cause lasting damage. 5. Changes in vision in one or both eyes. Did you know that vision problems can sometimes be a sign of a stroke? That's right. When you experience sudden changes in your vision, such as blurred, double, or lost vision in one or both eyes, it could indicate that the part of the brain responsible for processing visual input is being affected by a stroke. It's important to note that this symptom isn't just about blurry eyes from being tired. It's about sudden and noticeable changes. So if you or someone you know experiences any of these visual changes, don't wait. Seek medical help right away. Recognizing these signs is the first step towards seeking timely medical attention. Acting fast can significantly improve outcomes in stroke patients. Now let's talk about another type of stroke, a hemorrhagic stroke. This happens when a blood vessel in the brain leaks or ruptures. Here are 4 signs to look out for. 1. Sudden severe headache. One of the most noticeable symptoms of a hemorrhagic stroke is a sudden and severe headache that can feel like a brain aneurysm. If this happens, it's important to seek medical attention immediately. The sooner you get help, the better chance you have of preventing further complications. 2. Nausea and vomiting. Have you ever felt queasy after experiencing a severe headache? Nausea and vomiting can sometimes accompany a hemorrhagic stroke, especially when a blood vessel in the brain ruptures. These symptoms occur due to increased pressure in the brain, which triggers the body's natural response to expel fluids through the stomach. If you or someone you know experiences persistent nausea and vomiting along with a severe headache, it's crucial to seek medical help. No. 3. Dizziness and loss of balance. When a blood vessel in the brain bursts, it can lead to dizziness and loss of balance. This happens because the bleeding affects the part of the brain responsible for coordinating movement and maintaining stability. If you or someone you know suddenly feels dizzy, off balance, or experiences a loss of equilibrium, it's important to seek medical attention right away. Time is critical in treating a hemorrhagic stroke, and managing these symptoms promptly can prevent further complications. No. 4. Changes in consciousness. A significant change in consciousness is a serious symptom that requires immediate medical attention. In the case of a hemorrhagic stroke, the bleeding in the brain can affect the areas responsible for maintaining alertness and responsiveness. If you or someone you know becomes drowsy, confused, or unconscious, it's crucial to call for help. The sooner medical professionals can intervene, the better the chances of a positive outcome. Hemorrhagic strokes are less common than ischemic strokes, but they tend to be more severe. Recognizing the warning signs and seeking prompt medical care are essential for effective treatment and management. Now let's explore some additional signs that may indicate a stroke is happening. No. 1. Sudden weakness or numbness in the legs. Although it's more common for weakness or numbness to occur on one side of the body during a stroke, it can also manifest in your legs. If you experience a sudden and unusual sensation of weakness or numbness in your legs, don't ignore it. Don't ignore it. Seek medical help immediately, as it could be a sign of a stroke. No. 2. Difficulty walking. Another sign that could indicate a stroke is difficulty walking. If you or someone you know suddenly has trouble balancing or coordinating their steps, it's important to take action. This symptom often relates to a problem with the cerebellum, a part of the brain that coordinates movement. No. 3. Problems with coordination and fine motor skills. Beyond walking, you might encounter problems with hand-eye coordination and fine motor skills. If you find yourself struggling to perform tasks that require precise movements, such as buttoning a shirt or using utensils, it could be a sign of a stroke affecting the areas of the brain responsible for these functions. No. For slurred speech. In addition to confusion and trouble speaking, slurred speech can also be a warning sign of a stroke. Slurred speech occurs when the brain's regions responsible for language and speech are impacted, making it difficult to articulate words properly. No. 5. Difficulty swallowing. Another sign to watch out for is difficulty swallowing. If you're having trouble swallowing or feel like food is getting stuck in your throat, it could be a sign that a stroke has affected the nerves and muscles involved in this process. These additional signs highlight the wide range of ways a stroke can manifest itself. It's essential to pay attention to any new or sudden symptom that arises, as it could be a crucial indicator of a stroke. Remember, acting fast can make a big difference. Don't hesitate to seek medical help if you notice any of these signs in yourself or others. If you found this video informative and want to learn more about stroke prevention and brain health, check out our other videos by clicking here. Your support means a lot to us, and we look forward to continuing to provide valuable content on senior health and wellness. Thanks for watching.